It is still scary for us, but we do what we have to do. We take care of everything and anything that comes our way.
Amid warnings of the hardest and saddest week yet, New York could see its infection rate peak. This at a time when hospitals are nearly full.
It's so different than most anything we've cared for before.
ABC News inside Brooklyn's Maimonides Medical Center.
This is one of the epicenters of the epicenter in New York City. Behind me, you can see the white overflow tents they have right here. They're seeing so many COVID patients. Right now, they assume 80% of the patients that come in are COVID. They're getting ER patients every 14 minutes.
Pretty much the entire emergency department's a hot zone at this point.
According to a report by FEMA reviewed by ABC News, New York City hospitals will likely be at or near total capacity this week. Governor Andrew Cuomo says doctors and nurses are being asked to do the impossible.
The system is overcapacity all across the board. It's just overcapacity. You're asking a system to do more than it has ever done before, more than it was designed to do with less.
The president sending more than 1,000 medical military personnel to aid hospitals in the city and help run the 2,500-bed Javits Center. The convention center, one of the largest hospitals in the country, and now able to treat COVID-19 patients. Over the weekend, the rate of deaths initially spiking. A person dying from COVID-19 in New York every 2.5 minutes. But on Sunday, Governor Cuomo reporting the daily death toll in the state dropped for the first time. The disease killing more than 4,000 New Yorkers. But still, small glimmers of hope even in hardest hit New York. 75% of those hospitalized have already been discharged and are on the mend.
With the economy spiraling, one of the biggest questions is, when is that government stimulus money going to start flowing to Americans and businesses?
I'm pleased to report that within 2 weeks, the first payments will be direct deposit into taxpayers' accounts.
But it's not that simple, because there are 80 million Americans who have not signed up for direct deposit, and that means they still have to wait for a check in the mail, and printing all of those checks and getting them mailed out could take several months.
Supposedly they're sending us $1,200 from the federal government, which will not pay my rent.
For some small businesses, signing up for the government's payroll protection program to keep them afloat has been equally frustrating.
Applying for those programs has been kind of like boarding an airplane that's still being built, but it's taken off.
Now, as for signing up for direct deposit, an IRS website is still likely weeks away, but now TurboTax has a new website. You can sign up there. They say if you give them your bank information, sign up for direct deposit, you should be able to see your stimulus money much faster.
You know, drone delivery has always been an intriguing idea, but now it's getting a closer look in the coronavirus pandemic. The FAA tells us they have seen a flood of requests to expand drone operations in the United States. There are a lot of concerns about safety and privacy of drones flying all around.
Drones running into each other, maybe hurting somebody on the ground.
But a number of companies hoping to use drones to expedite deliveries to rural areas. Some law enforcement agencies want to use drones to enforce those lockdown orders. And there's even a group of researchers out in Kansas looking at possibly using drones to process and collect samples for coronavirus tests.
There's a really intense need right now to basically be figuring out ways of treating more people at home so that we can keep the beds in the hospitals open for COVID-19 patients.
The FAA tells us that emergency authorizations for the use of drones are still strictly limited in numbers and in cases to the rules that already exist are in place, but there is that big push, there is that movement underway. Some experts hope that this crisis could be a game changer for drones. So far, no big changes just yet.
People across the country continue to find creative ways to thank everyone on the front lines during this COVID-19 pandemic. In Mississippi, members from over 20 different churches drove their cars to the Singing River Hospital in Pascagoula, flashing their lights and honking their horns to thank the doctors, nurses, and other staff hard at work inside.
I know the instructions had gone out not to honk, but as soon as they came out, you could just feel the emotion swell up and horns start blowing up. It was just a real natural response to just pour out our thanks to these people that are taking care of our friends, our family. It's just overwhelming.
And critical care workers in Thousand Oaks, California took some time out of their busy day, delivering a hearty lunch to thank another group working on the front lines, grocery workers. Chris Banner normally entertains at birthday parties and other special occasions, but during this time of social distancing, he's looking to bring a little happiness to as many people as he can. Chris dons his bat suit and hits the road in his replica 1989 Batmobile. He hopes seeing Batman roll down the streets will help people feel like we can take on this new supervillain, coronavirus. Healthcare workers at Hershey Children's Hospital in Pennsylvania are breaking out their dance moves to boost morale. Staff from the Pediatric Intermediate Care Unit danced to Sister Sledge's classic, We Are Family. The clip was posted on Facebook with the caption, "Sorry, coronavirus, you can't take away our sunshine."